Good morning, everyone, and welcome to Ask a Doctor, our twice-a-week live YouTube stream where we turn to you, the audience, to ask any and all health-related questions. I'll be looking for those in one of two ways. You can ask them in the chat section off to the side here in YouTube. You do need to be logged in to post to the chat, but I'm monitoring that, and I'll ask the doctor whatever health-related question you have. You can also email your questions into us if you're having any trouble with YouTube or it's in between live streams and you don't want to forget a question. Send us an email at office@tlcdoctors.com. Just make sure you put somewhere in the subject line question for YouTube live Q&A, and I'll be sure to ask that on a following episode. So why do we do this and what's the point? Well, we're here to on a mission to change the health of people that we care about and their extended families by informing you and educating you on some of the simple things that you can do in your life, some changes that you can make to radically affect your longevity, your health, your wellness, your energy. And we're just sharing with you some things that we found work over many, many decades of experience with our patients. So that's why we're here, and we want to spread the word. So make sure that you tell your loved ones, your friends and family about this. Of course, we're located in Southern California and we are accepting new patients, but anybody can tune into this and ask any health-related questions. This is for information and education, as I stated earlier, not to replace your relationship with your doctor. Specific medical questions should always be under the care and followed up through a medical professional. So we're treating this for education purposes. And with that being said, we just recorded a video for our patients on chelation therapy. That'll be posted to YouTube here within the hour. So if you're subscribed to our channel, by clicking that subscribe button, you'll be notified when that comes out. And if you're finding value out of this, please do hit that like button. Well, Doctor, thanks for being here again today.
Well, thank you for running this whole enterprise.
That's a pleasure. And we do this twice a week now.
Right.
You're here on Monday evenings. Mm-hmm. You're finding 6 o'clock is a good time for you?
Yes, yes.
Okay, so you can also tune in Monday evenings at 6 o'clock. Doctor spends 30 or 40 or 50 minutes or even longer sometimes with people getting deeper into questions. And of course, today's Wednesday morning. We're here at 9:45 a.m. Pacific for about half an hour before Doctor has her first patient in. Okay, I'm looking at the chat and I don't see any questions coming there just yet. So why don't we start with some questions that were emailed in to us? Okay, Christina sent an email and said, I've listened to you mention that daily baths are not good as they take off good bacteria and dry out skin. In that same vein of thought, would you recommend not washing my face in the morning? I usually do, as it helps wake me up and is a routine.
In general, the skin is an organ itself. It's a viable organ.
Some would argue the largest organ in your body.
Yeah, the largest organ in your body. And as you age, your production of oils diminishes. The collagen, elastin that supports the thickness of the dermis diminishes and you start to sag. And when that happens, if you're taking baths every day with soap and a warm shower or bath, you are literally dissolving away with the soap and the warm water those oils that help keep the content of this skin organ running optimally in its defenses. Therefore, the older you get, the less you really should shower. If you shower, I would ask you to do it no more than once a week with tepid water, as cool as you could tolerate it, as briefly as you could tolerate it, and try and commit the soap to your pits and hair and not on the rest of your body. Therefore, when you're done with your shower and drying off, any of the dirt or stuff will come off with exfoliation when you're toweling off. Now, when you get old, you tend to have more stiffness and aches and pains, and getting in a hot water bath gives a sense of relief. But again, that's just symptom control. That is not management of the problem.
Right.
And as you get older, you tend to drink less and less water. So we're dehydrating, our skin is thinning, and our oils are being washed off. Now, if you're young and you wake up in the morning and you want to wash your face, this is probably fine. But you don't have to. Your skin is designed to exfoliate all the time. And I personally never wash my face. And I'll just put my makeup on in the morning, whatever was there before. That's who I am. I'll use my my natural hormone, estradiol, and I'll put that onto my face. And if there's a little mascara there, I'll wipe it away with a tissue. But I never wash my face except if I take my shower very rarely throughout the month. And that way my skin tends to be more soft, more plump, less aged looking, and less wrinkled. So I sponge bathe. I have like 10, 15 washcloths, and I'll just wash the pits, and then I will go from there. So if you're young, it's probably not as critical a factor, but as you age, it becomes more and more important past the age of 40, I would say, when you're really starting to have muscle mass loss, you're starting to have increased inflammation in your body, aging starts to take place. Using hot water or soap on your body frequently, and I have patients who are washing twice a day, showering twice a day. And it's the hardest thing to break that marketing for you to apply things to your skin. Then you get itchiness. Now the side effect of your skin drying and cracking is you get itchiness, okay? And then you start scratching it. Then you start getting breaks in your skin. And then bacteria can far more easily invade into, and as you get older, your immune system diminishes. This becomes a problem. So you can start getting eczema with aging. So I just have to encourage people to understand we were fearfully and wonderfully made. We're designed to exfoliate naturally. And yes, the only place where bacteria is at is in your armpits and your groin and your feet. And your mouth, so you should brush your teeth twice a day. But long the short of it, try to learn to shower less, bathe less, and
it is the soap and the temperature of the water that is getting rid of that protective oil.
Yes.
So splashing cold water on your face is fine.
Should be fine.
Yeah.
Mm-hmm.
Okay. All right, we have part 2 of that question from Christina was, are there cosmetic companies in which I should avoid using their products or certain ingredients? Could you recommend some safe, trusted ones?
I cannot.
That's a question for maybe Dr. Mitchell or Dr. Cora. I know they have a wealth of information. So I sense that in the next couple of weeks, we'll be putting out some videos that are not live where we're speaking on these specific subjects, and this is one that comes up a lot. So I'm going to get their help to list some trusted resources of some organic, safe cosmetics.
Yeah. I'm very practical. I grew up on a farm, one room, no toilet. So cosmetics and these fancy things of life, I have never paid attention to.
I'm looking at the chat, and we have a message here from, it looks like David Hertzberg. He says, good morning from Sholo, Arizona. Maxine and I are here for the arrival of our first grandchild expected today. We love your loving guidance and protocols. Well, thanks, Mr. Hertzberg. Congratulations.
Yes.
What an exciting and wonderful time for you.
Yes.
Jeff says, I exercise 5 times a week and do yard work on the weekend, so I feel I need to clean off. Is just tepid water rinses okay daily then?
I would keep that to a brief, in the military we had what was called a 3-minute shower, and it was cool water.
Yeah. And
so if you can handle a 3-minute cool, tepid in and out, then I would say you're probably going to do okay.
Right.
But
there are many benefits and even studies that have been done on cold showers.
Yes.
And certainly subarctic, even colder kind of exposure. I know for men it helps produce testosterone and growth hormone and decrease inflammation. I take a couple showers a week, but it's very brief, it's very cold, and I'm kind of just soaping under my armpits and my groin and then rinse off when I get out.
Right.
Yeah, and if you are in the yard, if you're exposed to chemicals and things out there, you do want to get that stuff off of your skin.
Course.
Okay. We have another question that was emailed in here. This was from Sarah, and she said, I have heard you say that the COVID-19 vaccines are not recommended by you based on previous issues with the pharmacies. I took the Moderna vaccine in May of this year, and now I wonder if I've done irreparable damage to my body. I haven't had COVID or any symptoms related to the vaccines, but could there be long-term effects of taking the vaccine?
Well, that's the reason that it takes from 5 years or more usually for a vaccine to be authorized to do these kind of studies, so that we can answer these kinds of questions. And so I don't want you to be alarmed. I have maybe 15% of my patient base has taken the vaccination for either Moderna or Pfizer and some Johnson & Johnson, and they've all done well. And so we're approaching about 8 months of data on this. So I can say with my patients who have taken care of their bodies, who take systemic enzymes in particular, Vitalzyme, Vascuzyme, Proteozyme, these systemic enzymes on an empty stomach help to prevent inflammothrombotic problems that have emerged, especially from these AstraZeneca vaccines in Europe, where they got the central venous thrombosis in the brain, and some women have died from this. And so these spike protein generated microclots are to be expected. So what do we say? We say in this office, drink that water every day. We hammer it. The other thing we say is keep your sugars very low and starches so you don't get sticky, sludgy blood flow, which would promote clotting. We say take the enzymes, which are proteolytic Pac-Men, like little soap suds inside. We say get a good night's sleep so your body has healing and restoration. And we give other things like vitamin D. We had the TLC Energy Core or Mitocore. This had the many of the items that are very beneficial for overall health. That's why we designed it that way. And it has the zinc in it. So if you look at water, low carbs, systemic enzymes, moving your body, we always talk about some daily little activity. Do your rebounder, do a 15-minute, 20-minute treadmill every day. If we do these things, none of my patients have had a problem. But the other blessing is you can come and get chelation therapy. EDTA chelation therapy is a mechanism known for 70 years now, and I have more than 40 years of experience with it. I teach it to the American College for the Advancement of Medicine, which is the foundation of chelation in the world. And I teach doctors about chelation therapy with my colleagues, and it improves microcirculation. If you go to the TACT trial, TACT trial number 1, the TACT trial number 2, and the TACT trial number 3, TACT stands for the Trial to Assess Chelation Therapy. There was an NIH-sponsored study based on a retro meta-analysis of qualified randomized controlled trials of chelation done over the decades, okay? And when they saw the benefit of chelation therapy, the NIH funded the cardiologist, Dr. Tony Lamas, L-A-M-A-S, with I think it was, what university was that? University of Miami. Yeah. And he then, and still is, running TACT Trial 3. And he has established the prolonged survivability post-heart attack of those people who did the chelation therapy to improve the circulation throughout the body. We know it's the microcirculation, folks, that is what is redeeming. So some people have a heart attack and they don't die. That's because they have other little pathways that they can get around the traffic block. You see what I'm saying? So EDTA chelation helps peripheral vascular disease, especially in diabetics, post-cardiac, and preventatively helps you stay younger, longer, and that's why I do it on a routine basis. So that was a long way to go from that question on the Moderna vaccine and have you done irreparable damage. I would say do not worry. I would say do these wonderful things. Follow up with a doctor who is familiar with chelation therapy and functional medicine, integrative medicine. We have 5 clinicians here that can all help very wonderfully if you have any concern about being inflamed, or we could do a D-dimer test to see if you're still making clots. We can do the HSCRP to look at vascular inflammation. We can do all these things. So I would reassure her, I would comfort her.
Excellent. Okay, well, no more chat questions right now, and that was it. We're all caught up on the email questions. Anything you wanted to talk on?
Well, I would just say, going off of that as well, if you look at what has helped the population, we have several thousand patients amongst us with the 5 clinicians here. Not one of them died. Not one of them were hospitalized. Did some of them come down with flu-like symptoms, fever and stuff? Yes. Did we manage them and have they all done well? The answer is yes. So then you have to ask the question, why isn't medicine practiced in this fashion where we're giving leadership and comfort and hope to our patients? And why, when we have so many patients that are diabetic, many patients who are fighting cancer, undergoing chemotherapy, many patients who have heart disease, hypertension, many patients who are overweight, many patients who have autoimmune disease. When you look at all of this group, we have a sampling of the world population, and we have Black, we have Hispanic, we have Caucasian, we have Asian populations here, and they've all done well. So it is prevention that is what medicine should be. It is being a doctor who is able to look at all things coming at him. Now, yes, we need a skilled, specific person who can do a colonoscopy, a skilled, specific person who can do, orthopedic repair after a motorcycle crash and broken bones. Yes, we need someone who can do open heart surgery if needed, and catheterization for evaluation. We need this, but we don't need them all as specialists. We need the vast majority of physicians to restore the joy of being your family doctor, of being the doctor who is leading the way for prevention, and like the little baby coming for the Hertzberg family, leading the way to have healthy men and women and fertile, healthy children, and the joy of raising that child up to avoid like the sugars of the fructose that are infused in some of the formulas that have heavy metal toxins in it. So we are doctors who are looking at all this stuff, and I would say we have helped our patients develop their own immune strength and maintained it. And we have given them hope, because I do think another part of the human body is the spirit. And so mind, body, so if you don't address the hope for the patient, joy, things like this, along with healthy lifestyle, diet, tailored research, nutraceuticals that are beneficial, I don't think you're doing medicine. I think you're practicing pharmacopoeia. And we have a lot to say about pharmacopoeia, don't we?
We do.
That's one of the reasons why we've run out of the calcium EDTA and have to go to the disodium EDTA. They're both the same. It's just I prefer the calcium disodium because I can run it in a little bit faster. The disodium EDTA takes a little bit longer. Both identical, and in fact, the original chelation therapy was taught on disodium EDTA.
Right.
But so I would just reassure people and try and help your healthcare providers to look at functional medicine. They could go to acam.org and go to some of the lectures, and it's not just on chelation therapy, it's on a broad spectrum of preventative medicine. They can go to the Institute of Functional Medicine, Dr. Jeff Bland's site. They could go to the A4M, American Anti-Aging, A4M is the name. Yeah, A4M. And their doctors convene to start opening up their mind as to how to be better in prevention. There's another one, ACAM, A4M, Institute of Functional Medicine. Well, anyway, there are plenty of places. So encourage your healthcare provider to open up and be a part of that. Share this video with them, and you'll find I repetitiously bring up the same features of health, and you'll find they all benefit. Like, I am doing this 5-day fast. I'm starting day 3. So I haven't had one bite of food or any fat. I didn't make bulletproof coffee. I didn't do a thing. I am just drinking water, and I have black coffee. And I feel so energized. I feel fantastic. I feel my brain and mental acuity is on a sharper level. I feel my sleep is more deep. I have, I usually feel very great about my joints, but even now I even have any less measure of stiffness to start the morning, and I'm almost 70. So eating a lower carb diet, which I have pushed here for 20 years, long before this keto fad emerged and stuff, I was always doing this. This is beneficial. It's associated with prevention of many disease entities and even cancer management and prevention. So these are things that I think are well worth looking into, sharing with your healthcare provider. And they could even come here and shadow us if they wanted to spend a day out in Southern California. We have them coming all the time. We have nurses, we have medical students, we have doctors that shadow us. And I think we're interested in hiring another physician, right? Right. So we're on the hunt. I would like to have a male physician in that we have a large amount of male patients who need their male prostate exams, and so this would be very helpful to have a man for that purpose.
Right. I have a question from Elizabeth, and she asks, I have a friend whose 18-year-old son is having neurological issues due to taking the COVID vaccine. Would all of your recommendations that you just spoke about help this young man?
Absolutely. He should be getting chelation therapy. He should be on systemic enzymes. He should be drinking half his weight as ounces in pounds. So if he's 180 pounds, then he needs 90 ounces of water every day. He needs probably a richer fat diet, more like a keto or a carnivore diet, because for all that cell damage that he's had, it's repaired with these cell membrane bilipid phospholipids. We have that as a supplement here, but you could get it from eating egg yolks, chicken with the skin on it, beef and such.
Right. And that supplement is a powder. It's called, I think it's called NT Factor powder.
NT Factor powder,
and
yes.
then it is also, there's a large dose of it in the doctor's nutrition bar.
Yeah, the doctor's nutrition bar is jam-packed full of cell membrane reparative material. It's not designed to be a fun bar. Mm-hmm. It's designed to be a bar that will satiate you and repair your cell membranes, especially the membranes lining your intestinal system.
Right.
And so, yes, he needs to get chelation most especially. And I believe, I would give them hope that he'll do very well. Mm-hmm. And when I was a young girl, when I was 15, turning 16, I got such a bad viral illness, they hospitalized me. And I was hospitalized for 4 months. I went in August and I got out in December. And what happened? I got a pan-myocarditis. So I got the heart inflammation from a viral illness when I was 15, turning 16. I was quite ill. And in fact, I was cardiac resuscitated once, okay? But the cardiac resuscitation then was in its infancy in the 1960s. Anyway, the long and the short of it is, my father, who was in food research, he was giving me shots of vitamin C. He was bringing me to doctors who do chelation therapy. I got chelation therapy by Dr. Ray Evers, one of the founders of the whole reason doctors can have off-label use of medicine is because Dr. Ray Evers loved his patients and would use his wisdom and training to cautiously use medicines for other purposes, okay? And chelation therapy was one of them. And so I was chelated, I got vitamin C, my father was all over my diet. I got so well after I got out of the hospital with this therapy that I got married a year later, and then I joined the ROTC and passed the Air Force flight physical. So you can see, if you have hope and if you have an open mind and you look at things where you have educated scientific physicians who are looking for safe ways to help you, your body is fearfully and wonderfully made. It will heal.
Okay, a question from Sylvia. She asks, I usually drink the Opti Cleanse GHI with ground flaxseed and almond milk in the morning around 11 or 12 p.m. Is this a good source of protein? I personally love the Opti Cleanse GHI. It's one of our highest protein, lowest carbohydrate meal replacement drinks, and it of course is it's based on a formula to reduce GI inflammation, and it's actually, some people use it as a detox shake. It has the same detox properties in it. Yeah,
it promotes liver detoxification. Yes. So I'm going to say what she's doing is fine. Mm-hmm. But I am going to put in the caveat that I think you should learn to eat healthy foods. Mm-hmm. It's a blessing that God has given us something as good as Opti Cleanse GHI. Mm-hmm. And that's got hepatic
inflammation,
intestine health, and so, but I'm always going to be the doctor who's going to say, learn to use the simple things, keep it simple, stupid. So if you can do some fasting, intermittent fasting, and I wouldn't have anyone do a 5-day fast like me right away, right? Especially if you had diseases like diabetes, insulin dependent. But for those of us who are otherwise healthy, fasting is one of the greatest cleansers you can do for your body. I'm undergoing autophagy, eating up old dead cells. I am burning fat. I'm detoxing where fat is one of the sources to deposit toxins. So you have to drink a lot of water to do this. But my point is, you can build up to this. So if you can first skip your breakfast and learn to eat between noon and 6 p.m., that's called intermittent fasting. That would be the first way. Once you can do that for a couple of months, then I would ask you to go from intermittent fasting to 24-hour fasting, where you would skip that lunch and you would just go from dinner the night before to dinner the next day. And if you can do that once a week and the other days intermittent fasting, you're going to improve your health. And then maybe every 3 months, try and do a 2-day fast, and then after that, try a 3-day fast every 3 months, and then a 4-day fast, then a 5. And you'll find after about 2 days, you are, those hunger feelings are so nominal, they will go away. I did have some hunger feelings, but they were very minimal compared to years ago when I first did this. Right. I was commenting to myself yesterday on the second day of the fast, how unhungry I was already. And normally women don't get into ketosis, fat burning, until day 3. I guess I've been living such a low carb lifestyle that when I went to my fast right away, I had almost no hunger pains. Yes, a little bit, walking around my kitchen, I thought, oh, it'd be nice to have a beef jerky stick or one of my, keto-friendly snacks. But I really had no hunger this time. So that's really exciting and motivating to me, because I could lose a few pounds. But yes, work your way to a prolonged fast, and maybe a 5-day fast, water fast you can do every 3 months would be the most. I do it twice a year.
And the only thing I would comment on that is with the almond milk, just pay attention to, does it have carbs, sneaky carbs or sugars in there? Because some of them do. When I use almond milk, because I like almond milk, I buy the unsweetened organic kind, and I use it sparingly. I won't stay on that for 2 weeks straight. I'll rotate in a different liquid. I see that we're just about out of time. I do see a great question from Lucia about hormone replacement therapy. And David, your question's easy to answer. Do you continue taking supplements during your fast?
Yes, I do. I'm on everything except my ortho digesine, because I'm not eating any food. So I'm taking everything else. I I'm a B positive blood, and you got to realize my dad in food research, when I was a little child, he would take these big brown jars and he would take a spatula for science and he would put a blop on each of our breakfast plates, and we would just have to eat the stuff. So I have learned to eat what's put in front of me. So if I do get a little, twinge in my stomach, I just drink more water.
Right. And let's go ahead and try to answer this question for Lucia. If this is running on, because I know I do need to get you to your patient, then we'll tackle it next week. But she says she has a question about hormone replacement therapy. What advice do you have about postmenopausal women taking daily hormone replacement, or do you recommend following a menstrual cycle, as in the Wiley method?
Well, the Wiley method, I worked with Wiley when she was developing her book on this in the 1990s, and I proofread it for her, so I'm very familiar. I don't think you should go to those high necessary levels. Now, there might be a few women who really love all that estrogen in them and they do better with it, so everyone's unique. So get a doctor that'll work with you. It's not that I won't prescribe Wiley, but I don't think you need those high levels. Now, I use a moderate level. I'm on natural hormones. I'm postmenopausal, and I do have a menstrual cycle, but it's light every month. Why? Because I use my progesterone only day 1 through 15 of every month. So I should shortly be having a little cycle here coming up pretty soon. So yes, I support it because that's part of rejuvenation. I put the estradiol cream to my face so I don't get the crow's and as much, because I already have the Bell's palsy that draws my right side of my face down and gives me trouble with my tongue and my speech since my vaccination in the military with a flu vaccination back then. It was 1984, and it was 1985 in January that I got it because I just had Brighton, your brother, and I went back to work in the emergency room, and they demanded that I get the flu vaccine. That I had the drop face immediately. So yeah, be on hormones. I love it. But be with a good doctor who will monitor you on that.
Yes, that's important. And you require all your patients to take their enzymes and drink their water.
Yes, you have to have a healthy lifestyle to be on hormones.
Yep. Good. All right. Well, I think we got them all. We got all the questions for today.
Good.
Wonderful. If questions come up during the week, email them into us, office@tlcdoctors.com, and just put in that subject line, questions for YouTube, live Q&A, and they'll be forwarded to us to ask on the following week. We'll be back here on Monday evening at 6 p.m. Well, not we. You'll be here. Yeah. Dr. E does an extended, longer, more in-depth. So tune in on Monday at 6 o'clock. You have your questions ready for her then. Until then, we care about you guys, and thank you so much for joining us. Spread the word. If you found any value watching today, do us a favor and hit that like button, and even better, hit the subscribe. That way, anytime we post a video, you'll be notified. All right, we look forward to seeing you Monday and then again next Wednesday. Until then, be well.
God bless.